How many jobs are being cut at the NIH? If you have been following the news about job cuts in government agencies, you may be wondering about the situation at the National Institutes of Health. So, how many jobs are being cut at the NIH? The National Institutes of Health is set to lose 1,200 positions as part of a larger restructuring effort by the United States Department of Health and Human Services. This reduction is part of a broader plan that aims to cut nearly a quarter of the workforce at the Department of Health and Human Services, totaling around 10,000 jobs across various agencies. These layoffs at the National Institutes of Health will affect not just support staff but also senior leaders. In fact, at least 5 directors from the National Institutes of Health's 27 institutes and centers have been informed that they will be reassigned. This reorganization is intended to streamline operations and focus on efficiency. In the context of work and employment, these job cuts reflected a significant shift in the structure and priorities of both the National Institutes of Health and the Department of Health and Human Services. The impact on medical research and public health initiatives could be considerable, as key experts and researchers are among those affected by these layoffs. Employees who are losing their jobs will receive severance packages, although some terminations may be linked to performance issues, which could affect eligibility for these benefits. The broader context includes major layoffs across other agencies within the Department of Health and Human Services. For instance, there are 3,500 job cuts at the Food and Drug Administration and 2,400 at the Centers for Disease Control and Prevention. These reductions aim to save $1.8 billion annually from the department's budget, which primarily supports programs like Medicare and Medicaid. The restructuring also involves consolidating certain functions under new administrative structures, such as the Administration for a Healthy America. Overall, the job cuts at the National Institutes of Health are part of a larger effort to reorganize and streamline operations within the Department of Health and Human Services. This will likely have significant effects on the workforce and the services these agencies provide.